The Manitoba government has been on a mission to try and recruit more doctors from out of province and all across North America. On our show, we recently had an American doctor who came to work here. The political climate in the U.S. has been one of the reasons for some doctors making the move to Manitoba. But now Manitoba is also trying to woo Quebec physicians. The province is banking on its bilingualism to attract Francophone health experts. And it all comes amid growing tension between doctors and the Quebec government over the passing of Bill 2. CBC Radio Canada's reporter Catherine Moreau has been working on this story, and she's in studio with her report about it. Hi, good morning.
Good morning, Marcy.
So can we start with what's happening in Quebec? What is Bill 2? Why are doctors there unhappy?
Yeah, Bill 2 is a legislation that takes effect in the new year and will impact how doctors are paid because it will link compensation to performance targets relating to the number of patients doctors have. The legislation would also impose fines up to $20,000 per day on doctors who take quote, concerted action to challenge the government's policies. Since the bill passed last month, there has been an exodus of doctors there, many of them going to Ontario, being tempted as well by New Brunswick, who put out an ad targeted towards the bilingual doctors, where they say they feel more supported. And that support is something that did come up when I spoke to a doctor here in Manitoba who trained as a physician in Quebec, but chose to come work here in Winnipeg. She's been here for 3 years now. Her name is Dr. Annie Drapeau. She's the neurosurgery residency program director and pediatric neurosurgery service lead at Winnipeg's Health Sciences Centre. So I asked her how Manitoba compared to Quebec and to the U.S., where she also worked for 6 years prior to moving to Manitoba. Here's what Annie Drapeau had to say.
Here, I really feel supported and heard, and either at the hospital level or the government or my colleagues or my leadership, really about, what are some of the challenges that we have. And there's no quick fixes, but it does seem like people are trying to work towards a more broader solution. So I think that's a really great place to be, where you feel respected and heard, and there's momentum, and you see things changing in the right direction.
And what has our province said about the new recruitment campaign?
Well, in a written statement, Health Minister Uzoma Azaguara speaks about what Manitoba has to offer. I'm going to quote them. We're showcasing Manitoba as a welcoming and affordable place where physicians can build rewarding careers with an excellent quality of life. We offer a career in strong public healthcare system, one that serves a diverse population, including French-speaking communities, and direct one-on-one support for physicians looking to become unlicensed in our province. End of quote. The minister says it's a targeted digital recruitment campaign emphasizing Manitoba's reduced regulatory burden, increased autonomy, opportunities to build their practice in a large Francophone community.
Targeted is right. I mean, that last part of that quote, direct one-on-one support for physicians looking to become licensed in our province and highlighting the bilingualism. Mm-hmm. How much interest has there been from Quebec doctors wanting to come work in Manitoba then?
So I actually reached out to Doctors Manitoba to see if they'd heard from Quebec doctors. Here's what they shared in a written statement on Friday. We had a lot of interest from Quebec physicians about opportunities in Manitoba. So just last week, this was now 10 days ago, at the Family Medicine Forum, which is a major national conference that was held this year in Winnipeg. I'm quoting still, our booth was busy with physicians from other provinces interested in Manitoba, particularly colleagues from Quebec. We are connecting those with physicians from the Manitoba Government Recruitment Office and are happy to support their transition in practice here and when they relocate to Manitoba. So going back to the end of quote. Mm-hmm. Going back to the province's efforts to recruit Quebec doctors, in addition to the digital campaign, a virtual webinar for French-speaking physicians is being offered no later than today. As of last week, more than 100 physicians had signed up for it. So the webinar, Marcy, will provide physicians with a clear understanding of what makes Manitoba a uniquely attractive place to live. This is according to the province, work and build a career in medicine. And attendees will also hear directly from Francophone physicians who have made the choice to move to Manitoba.
What has Dr. Drapeau been hearing from her Quebec counterparts about the working conditions and political climate there then?
So she definitely highlighted again the lack of support her colleagues are getting in Quebec. She does say some of the issues are similar between our two provinces, the lack of staff, for instance, and administrative support. However, she's hearing from her Quebec colleagues stories about having to perform non-medical tasks because of shortages, like changing beds between patients. So, and she's heard from all of them that there is definitely people moving or intending to move to she said Ontario and New Brunswick. So according to her, they feel exhausted, blamed for the current situation, and they feel pressure to find solutions and they don't feel respected. A lot of her colleagues feel very hurt by the situation in Quebec, and I'm quoting her here. They talk about a moral injury. So she says her old classmates have told her about thinking to moving to those two other provinces, but not to Manitoba, something she is trying to change herself.
I've definitely been the one to mention Manitoba and to tell them to think about it because it's a great place to live and to work. Many of them have mentioned that there's been an increase in requests for licenses to practice in Ontario and New Brunswick. And as soon as I mentioned Manitoba and, being a bilingual province for the most part, they all kind of, act surprised and go, oh yeah, I didn't think of Manitoba. So I definitely think we have an opportunity here to recruit and be visible and encourage people to think about Manitoba because it's a great place to live and to work.
So obviously she's been championing this. Sounds like she thinks the grass, for her at least, is greener here.
Yeah, well, she repeated many times during the interview, "Il fait bon vivre ici," or "life is really good here." And so the quality of life was definitely something that came up frequently. But for her, the bilingual aspect is definitely something that is a strong factor in her staying here. So I asked her about the presence of French professionally, what it changed for her and personally as well.
I will say this to anybody who wants to hear it, but French is really present here in Manitoba and Winnipeg and many of, the surrounding communities. And in my work, I work at an English hospital, but French is definitely present with many of my patients, some of the staff. I definitely appreciate, how important it is to be bilingual for some of the French Manitobans who feel more comfortable speaking in French, and actually a lot of immigrant patients. And you'll see them physically relax and be kind of, feel a little less stressed to be talking to a doctor if they can be heard and spoken to in French.
Thanks for adding to our series of conversations now about doctor recruitment outside the province. Catherine, appreciate having you here.
My pleasure.
That is Radio-Canada reporter Catherine Moreau, live in Studio 15 with us in the show.